today's tutorial, we'll be looking at verbal and non-verbal communication skills in a healthcare setting. So this is aimed at most healthcare professionals, but especially midwives and nurses. So here's the definition of communication. Communication is the process of sharing and conveying a message or information from one person to another within a cross-channel context, media, and culture. So there are two main types of communication. This is verbal communication skills, in which interactions occur through the use of words and listening. The other one is non-verbal communication skills, which can be written or interaction that is behavior based. So it could be gestures, signs, and symbols, as well as using a body language. So both verbal and non-verbal communication skills can be used simultaneously in most healthcare settings. So the learning outcomes for these tutorials are: we will recap the Nursing and Midwifery Council Code of Conduct. So this is for UK-based students. Then we will move on to evaluate verbal and non-verbal communication skills, different types of communication aids, and different types of support services that are available for people with communication impairment. In the Nursing and Midwifery Code of Conduct, point 7 outlines the importance of communication in a healthcare setting. So 7.1 states that you should use terms that people in your care, colleagues, and public can understand. So this is all to do with terminology. You have to, when you're communicating with your patient, compared to when you're talking to a healthcare professional, you have to think about the terminology that you use. And you have to think, does my patient understand the words that I'm using? You have to convey your information in a way that a layperson, for example, a patient who doesn't have the understanding of scientific or medical terminology, can understand. 1.2 states that you have to take reasonable steps to meet people's language and communication needs. So this is, for example, if they speak a different language to you, or if they have communication disabilities. So if, for example, if they are visually impaired, or so visual impairment, hearing impairment, or also come into consideration. You have to providing wherever possible assistance to those who need help to communicate their own or other people's needs. So, for example, you might need the assistance of a translator, or you might need other forms of communication. So, for example, writing or other technologies that would help you communicate with your patient. 7.3 states that you should use a range of verbal and non-verbal communication methods and consider cultural sensitivities. So, for example, if you're using certain gestures, this might be different. The gestures that you're using might be different, might have a different meaning in different cultures. So you would have to take consideration. You have to take the gestures that you're using into consideration to better understand and respond to people's personal and healthcare needs. 7.4 states that you should check people's understanding from time to time to keep misunderstanding or mistakes to a minimum. So, for example, if you give a person instructions, information, you'd have to say, do you understand? Did that all make sense? And then you'd proceed to say, do you have any questions? Please if you don't understand anything, then make sure you ask me to clarify. So make sure you always, your patient or other healthcare professionals know exactly what you're saying to them. So always ask follow-up questions and just make sure the information that is being communicated is well understood. 7.5 states that be able to communicate clearly and effectively in English. So this is for UK students. So you'd have to make sure that you can communicate clearly and effectively in English. So when communicating, confidentiality is very important in a healthcare setting. And the Nursing and Midwifery Council in point 5 go through the importance of confidentiality. So 5.1 says you should respect a person's right to privacy in all aspects of their care. So if you wouldn't be talking about a patient in a corridor or outside of the working environment, you'd have to discuss their medical information with them in a way that is confidential, and no one else that doesn't have authority to know the person's medical information does not have access to it. 5.2 states that you should make sure that people are informed about how and why information is used and shared by those who will be providing care. 5.3 states that you should respect that person's right to privacy and confidentiality, and this continues even after they have died. 5.4 states that you should share necessary information without other healthcare so you should share necessary information with other healthcare professionals and agencies only when the interest of patient safety and public protection. So when the patient safety and public protection override the need for confidentiality. So for example, if there is a new outbreak of a new disease, then that would mean the government and other agencies have to know, for example, who patient 0 is. And therefore, this information needs to be made public and be shared with professional agencies and the government. 5.5 states that share with people, their families and carers, as far as the law allows you, the information they want to be known about their health, care, and ongoing treatment, sensitively and in a way they can understand. So this means you cannot just share any information with, for example, a person's sibling, their parents. Especially, for example, in the UK, if a person is over the age of 16, they have the right to consent to who their information can be shared with. And there are laws governing ways that information can be shared. So one of them is the General Data Protection Act. So you'd have to refer back to laws that are associated with sharing information when sharing confidential medical information. Okay, so now we'll move on to verbal communication skills. So verbal communication skills is the use of words and listening. So there are some advantages to verbal communication skills. It's instant communication. So if it's face-to-face, if it's on the phone, if it's on a video call, you can communicate with the person instantly, and it's personalized. So the person you're talking to can talk to you, can ask you questions. It's quite personalized and you can communicate. It can also be reinforced with non-verbal communication. So the use of gestures, expression, body language. So for example, if a patient is asking for a direction to a particular ward, you can use verbal communication skills but also direct them by using your hands and gestures. Also, it provides the opportunity for clarification. So when you're talking to a person face to face on the phone or on a video call, you have the opportunity to ask questions, follow up questions, clarify with them, also ask them if they understood. So there's an opportunity to clarify what needs to be said. And it does not have to be face to face. So it could be on the video call or it can be on the phone. So some of the disadvantages for non-verbal communication skills, for verbal communication is a percentage of the information will be forgotten. So for example, if you instruct a person to do something, or you give them a lot of information, there's a possibility that they could forget what you have said to them. So there's no point of reference. So unlike, for example, in writing, where there's a point of reference a person can refer back to, with verbal communication skills, there is no point of reference they can go back to. And it lacks consideration nature of written communication skills. So with written communication skills, a person can have the opportunity to look back on what is written. Also, it can be printed out in a way that suits their reading style. So that is some of the disadvantages. Okay, so non-verbal communication skills, the use of body language. This can be the use of body language, gestures, facial expression. So advantages is it provides positive and negative body language, which can be interpreted quickly. So by smiling at your patient. The disadvantages is it could also be open to misinterpretation. So non-verbal written communication includes letters, memos, reports, manuals, forms, and fax and emails. The advantages of these are it's permanent, which means it's always available, less liable to misinterpretation. So what is written on a paper is less liable to misinterpretation. So a person is able to follow instructions from a written manual. Information may be absorbed at a reader's own pace. So with, for example, verbal communication, there is no opportunity for a person to process the information sometimes and process that information. So for example, with verbal communication skills, another disadvantage to it is, for example, if the person is rushing, they might communicate quite fast and the person might not have the opportunity to process that information. Whereas with written communication skills, you can read, you can process it in your own time, and then you can then consider how to reply. It's ideal for important details. So it provides evidence that a message has been sent, and also it's ideal for important, detailed, or complicated information. Again, this is to do with how it's, for example, if a medical information needs to be communicated to a patient, then they need the time to process that information and then select the best treatment for them. It can be used for communication outside practice as well as internally. So written communication can be used to communicate with the general public. So for example, giving out leaflets and sending out a personalized letter, for example, with regards to for example, if patient needs a surgery, then a letter can be sent to them with all the details that they require for the day and what they need to wear, what would be the process of the operation. All of those details would be on the letter. Also, emails are fast, can reach a large number of people. So If there is a general public health that needs to be communicated, then written communication is the best communication available for the general public. Okay, so non-verbal written communication, including letters, memos, reports, manuals, forms, and fax and emails. Also, leaflets are a form of communication, non-verbal written communication. So the disadvantages are they take time to produce, they're impersonal, there is no opportunity for discussion immediately or immediate feedback, possibility that it may not be received. So for example, if letters are sent, they might not be received. Also emails is the same. Not necessarily secure. So sometimes if a letter is sent or an email might be sent to the wrong person or wrong people. Email may be lost when technical problems arise. So now we will move on to communication aids. A communication aid can be anything that makes communication quicker and easier. They range from simple chart with words and pictures to portable electronic devices. So also translators are communication aids. So one of the communication aids is for stroke patients. So aphasia describes a language disorder that results from damage to area of the brain responsible for different aspects of language. One or several modes of communication, including comprehension and expression, which involves speech, writing, and gestures, may be affected. So aphasia affects, in a stroke patient, it affects their ability to communicate. One of the communication aids that is available for stroke patients is an E-tran frame. This is used by patients with locked-in syndrome and are only able to move their eyes. So they can use their eyes. What will happen is there will be a healthcare professional standing in front of them with letters. They can use their eyes to indicate a letter, word, or a symbol that is attached to a large frame held in front of them by a trained carer. The advantages are it gives the patient opportunity to express their needs in their own time. The disadvantage is if the message is long, this can mean having to remember a lot of letters, and it is easy to get the message wrong and become frustrating. So it's very important as the patient goes along, each letter has to be written down to remember what was said. Okay, so support services for patients with stroke. The Stroke Association is a charity in the United Kingdom and works to support patients and their families. One of the services offered by Stroke Association is computer-based therapy, which may have pictures or symbols next to words on screen to help with reading difficulties. There's a spoken commentary as well, videos with speech and language therapists showing mouth movement to help the user form different sounds or words. So limitations to Stroke Association. According to the Stroke Association, 1/3 of stroke survivors have problems with speaking, reading, and writing. As Stroke Association is a charity limited, funding can be an issue, which can lead to limited resources. Another communication aid is for all people with autism. So some people with autism have cognitive and communication disability. One of the communication aids used to communicate with a person with autism spectrum disorder is speech generating device, also known as voice output communication. Voice output communication aid is a type of electronic aid that can be used or replace language written by indicating images or sound. So it supports or replace language written by indicating images or sounds. So it's a bit similar to the devices that are used for a stroke patient. So limitations to the voice output communication aid is using this device requires patience as it takes longer to convey a message. For example, in order for a person to convey a message, they must first think about what they need to say, then enter the words into the device. Once they have finished what they needed to say, they have to press speak to say the words out loud. And this is a process. And it can be frustrating sometimes. So support services that are available for people with autistic spectrum disorder are the National Autistic Society, which provides support, guidelines, and advice to autistic people and their families. Baroness Angela Browning, along with the National Autistic Development, so Baroness Angela Browning, along with the National Autistic Society, developed a My Health Passport. And this passport is designed to help autistic people to communicate their needs to doctors, nurses, and other healthcare professionals. So there are some limitations to the National Autistic Association. Not be able to provide them with the necessary opportunities and activities. Another technology that is used is in the healthcare setting is assistive technology for deaf and blind people. Assistive technology enables people with disability, including those who are deaf and blind, access to technology. A deaf blind person normally uses a combination of assistive technology that assists them with hearing and assistive technology to assist them with visual impairment. So AT for visual disability is Braille display, which translates digital text into Braille dots that can be read with fingers. It can be costly, requires time for the message to be conveyed. So support services for deaf and blind people in the United Kingdom. So you have the British Sign Language. British Sign Language is a support service available to deaf and blind people. NHS uses British Sign Language. So in the translator, so in a healthcare setting, there might be a translator, and the translator uses hands-on signing in which the deaf-blind person, what is being signed by place. So the deaf-blind person would place their hands on top of the translators, and the translator would be signing what is being said. And the deaf-blind person would track what is being said and therefore get the information through the hands-on signing. Some limitations are training or hiring translator can be costly. Translators would have to be booked in advance. In an emergency, translation may not be available. Just to recap, communication is a process. And communication, when a person decides to convey a fact, idea, or emotion to others, he or she set a communication process. This communication process has the following elements: a sender, encoding, message, channels, decoding, receiver, and there's a feedback and there's the noise. So the sender is the person who sends the message. The message contains ideas, feelings, and opinions, etc. of the sender. Encoding. This is how the sender communicates their message. For example, verbal, non-verbal, the tone of the voice, body language, and eye contact. The goal for the sender here in the encoding process is to communicate something as accurate as possible. This means taking into consideration the knowledge, education, and background of the receiver of that message. So, for example, does the person understand the terminology that you're using? Do they speak the same language as you? Do they have any visual or hearing impairment? Do they have any disabilities? If you communicate in a way that cannot be understood, then the message is pointless. Then you have the message. The message is the idea or feeling that is being conveyed. Then you have the channel. So channels can be verbal or non-verbal communication. So this can be in writing, the body language that you use, the words that you use. Decoding. So decoding is the process of interpreting the message. The receiver is responsible for processing the message and assessing the content and gauge and understanding. Then you have noise. So the noise is anything that hinders the delivery of the message or cause misunderstanding. This can be physical. So for example, this can be, for example, environmental. For example, it can be if there's a noise around you, if you're working in a ward and there's a loud noise, then that can be a noise which interrupts the communication with someone through verbal communication. The person might be preoccupied with something else. For example, they might be having something going on at home. They might be experiencing mental health issues. And for this reason, the information that you convey to them might not be fully processed. So methods, other things that can hinder the communication is the message, the delivery of the message is the method of communication, the way you communicate with the patient who does not, for example, understand the language, scientific or technical words. Okay, so now we will move on to the receiver. So the receiver is the person who is receiving the message. For example, a patient or other healthcare professionals. Then here you have the feedback. With the feedback, this is the reaction of the receiver. This can be verbal, non-verbal. And this allows the opportunity for the sender to see if their message has been understood by the receiver. So this is the process of communication. Once the feedback has been received, the communication process is complete. And that's it. So hopefully you understand. This is really important for you to understand. And this is Claude Shannon, 1948. So you need to know the communication cycle, this communication cycle. That is the end of the lesson. Thank you for tuning in.